Your rhinoplasty results don't just depend on the surgery, they also depend on how well you take care of your nose during recovery. Here's what you should do and what you should avoid after surgery. First, it's important to understand that rhinoplasty is not limited to just the surgery itself. A huge part of the final result depends on proper healing and aftercare. After surgery, your nose gradually settles over time, swelling reduces, tissues heal, and the shape continues to refine over the next few months. That's why the first few weeks are extremely important. Now the question is, what is considered normal after surgery? Usually patients experience swelling, mild bruising around the eyes, nasal blockage, tightness, slight discomfort, especially during the first few days. And honestly, this is a normal part of the healing process. Many patients panic because the nose initially looks swollen, but remember, rhinoplasty does not show final results immediately. Sleeping position after surgery is very important as it plays an important role in recovery. After rhinoplasty, ideally you should sleep on the back, keep your head elevated, especially during the first few weeks. Side sleeping or putting pressure on the face can increase swelling and affect healing. That's why doctors often recommend using extra pillows or sleeping in a reclined position initially. Do's after rhinoplasty. Now let's talk about what you should do after surgery. Follow your doctor's medicines and instructions properly. Stay hydrated. Cold compresses can be used around the eyes, but avoid putting direct pressure on the nose. Do not miss follow-up appointments. Take proper rest and give your body time to heal. And most importantly, be patient. Rhinoplasty results improve gradually over time. Don'ts after rhinoplasty. Now let's discuss the mistakes that can affect recovery. Do not touch or press the nose repeatedly. Avoid starting heavy exercise or gym workouts too early. You may need to avoid wearing glasses directly on the nose initially. Smoking and alcohol can slow down healing. Forceful sneezing or nose blowing should be avoided during early recovery. Even small mistakes can affect swelling and the healing process. Diet also plays an important role in recovery. Soft, nutritious, and protein-rich foods help support healing. Maintaining proper hydration is also very important. Initially, it's better to avoid very spicy foods, excessively salty foods, alcohol, because all these can increase swelling. When does the swelling go away? This is probably the most common question. Most of the initial swelling reduces within the first few weeks. However, subtle swelling, especially around the nose tip, can continue improving gradually for several months. That's why patience is extremely important after rhinoplasty. The final refined results become visible gradually over time. What are the warning signs to watch out for? Now, an important part: when should you immediately contact your doctor? If you experience excessive bleeding, severe pain, high fever, sudden increase in swelling, difficulty in breathing, you should contact your surgeon immediately. Rhinoplasty is not just a surgery, it is also a proper healing journey. And the more carefully you follow aftercare instructions, the better your recovery and results can be. If you want to know more about rhinoplasty or would like to book a consultation, make sure to connect with us. And if you want us to explain the rhinoplasty recovery timeline or common myths in the next video, let us know in the comment section.